Hi, my name is Alexandra Myers, and on behalf of OPSC, I'm here to talk to you about how to get your first job after residency. The first thing I want you to ask yourself is location. Location is oftentimes the most important part of your job search. Do you want to be in a rural area? Do you want to be in an urban area? Do you have a family that you have to think of? Kids that need to go to school, or a spouse that needs to have a job as well? Do you already have family in another city outside of where your residency is? Those are questions that I would start to ask yourself early on in the job search process so that you can start narrowing down your opportunities. The next question I would ask is practice style. Do you want to be in an inpatient practice or an outpatient practice? Do you want to be in a solo practice, a small group practice, or a large group practice? Or does it really matter to you? Those factors will change your day-to-day in your work environment. And so I would start asking yourself that question early on so you can start searching for the group that would be right for you. Other questions I would ask are there academic responsibilities involved in your job? Do you want to stay involved with teaching residents, fellows, medical students? Do you want to have an association with a university? Do I want to work part-time or full-time? There's opportunities for you to work 0.6 or 0.8, and you want to ask yourself that question before you sign a contract. You also want to look at growth opportunities. There's a lot more to practice than just seeing patients. So do you want to get involved in administration or large-scale patient healthcare? And if so, you want to be in a practice where you have the opportunity to do that. The next topic I wanted to discuss was salary. You want to ask some questions early on in the process about what you need to support yourself. Do you have a mortgage, student loans? Do you have another income in the family? And what are you okay with receiving? It depends on your cost of living and what you expect your lifestyle to look like. You also want to look at the way that you're being compensated. Do you have a guaranteed salary, or are you compensated based on your production? Most practices will give you a guaranteed salary in the first couple of years and then transition to a production-based salary, and you want to understand that process before you sign a contract. The next topic I'd like to discuss is benefits. In your job, are you going to get health insurance for yourself and for your family? Are you going to get disability insurance? Do you have malpractice coverage? There's some fine changes in malpractice coverage that you want to understand coming out of residency. Do you have nose coverage? Do you have tail coverage? And how much of the malpractice will they cover themselves? You also want to know if you have disability insurance in case something happens to you while you're practicing medicine. The next thing I'd like to talk about is timeline. So when should you start your job search? If you're a third-year resident, you want to start it right now. You want to start asking yourself those first basic questions about location, for example. You want to narrow down the type of job that you're looking for and the place that you're looking for so that you can start calling and sending in some applications. If you're a second year or first year, then you have time to start thinking about those questions, and a lot of that will have to do with your family style. When should you start applying for a state license? So if you're coming back to California and you've been out of state, for example, it takes 6 to 12 months in order to get a state license in California. So if you're trying to come back here, you want to start applying for your state license. If you've already been here for your residency, then you're set. A lot of other states take a lot less time to get a license, but those are questions you want to ask, especially when you start getting close to signing a contract. When do you want to start work? So some people after residency like to take a significant amount of time off. It's the last time you're ever going to get time off before you start working. And it's the first time you've ever been able to take significant time off for the last at least 7 years. So I encourage you to think about starting in September or October and giving yourself some time to settle in the new location that you're coming at. All of the topics covered here today were covered in the New Physician's Guide to Practice, which I, along with Cassandra Mallory, put together on the OPSC website. If you have any further questions, you're welcome to comment here on this site and I'll make sure to respond to you, or else you can email OPSC directly. Thank you again, and I'm Alexandra Myers for OPSC.